In the rest of the world, this is considered unbelievably cruel, writes journalist TR Reid in The Healing of America. The "this" in his sentence represents the fact that in America, if you have employer-based healthcare and you lose your job, you lose your insurance, which is pretty fucking cruel. Don't give me any BS about COBRA, because if you've just lost your income, you're probably not going to be able to afford that. The funny thing is, you'll often hear some American politicians decry international health systems as socialist, when in reality, some of those systems are more capitalist than in America. They just don't turn anyone away from care because they're not covered, because everyone is covered. The term socialized medicine was coined in 1947 by a PR firm working for the American Medical Association to push back against President Truman's proposal for nationalized healthcare. And politicians have been weaponizing that term ever since. In his book, Reid breaks down the 4 types of healthcare systems that exist around the world because he traveled to all different nations to experience them. Interestingly, America has all 4 in this country, which is a big part of the problem, as I'll get to in the end of this video. First, you have the Bismarck Model. Otto von Bismarck invented the welfare state in Germany in the 19th century. In this model, healthcare is provided by private doctors and hospitals, but it's paid for by sickness funds, which are financed jointly by employers and employees through payroll deductions. If you lose your job, the government steps in to continue the employer's share of the insurance bill, so no one ever loses coverage. Germany, Japan, France, Switzerland, Belgium, and the Netherlands all use this model. In America, working people who get insurance through their employers are coverage under a Bismarck model. Next is the Beverage Model. William Beveridge was a British social reformer who designed Britain's National Health Service. Healthcare is provided for and financed by the government through tax payments, just like a police force or the public library in America. My wife and I just finished watching Disclaimer on Apple TV, and when people leave the hospital after care, they just walk out. There's no bills or administrative fees or bureaucracy to deal with. Most hospitals in this system are owned by the government, and most doctors are government employees. This model can be found in Great Britain, Italy, Spain, Scandinavia, and New Zealand. And America has it as well, because veterans, Native Americans, and active duty military personnel are covered under a Beveridge type system. Next up is the National Health Insurance Model. This model combines the Bismarck and Beveridge models. Healthcare providers are private, but the payer is on a government-run insurance program that every citizen pays into. Since there's only one payer, these universal insurance programs have considerable market power to negotiate lower prices. Canada, Taiwan, and South Korea use this model, as does the US. Medicare, which was invented in Canada, thank you Tommy Douglas, is based on this system. Finally, the out-of-pocket model. This is the system used in most of the developing world, where most people pay for healthcare outright. They just pay the bill. The poorest people in these countries often go their entire lives without seeing a doctor because they can't afford it. And this is what people in the US have to rely on when they're uninsured, which is why they have the poorest health outcomes. They really don't do preventative care. They often delay treatments, and they can sometimes only afford the lowest tier of care. If you're sitting in an office deciding which tests you should get to screen for cancer, there's a problem with the system, not with you. This patchwork system of healthcare on offer in America is considered barbaric by every other developed nation in the world, yet we endure it on a daily basis. The bureaucracy is astounding. I use a program called MyChart to access Providence Health System here in the Pacific Northwest, and it's one of the most fucked platforms I've ever experienced, and I've worked for a lot of software companies. There's no place in the world that has all of my medical records because of the 6 different insurance plans that I've had to use since COVID and the dozen or more before that. What Reid lands on is the most fucked reason for us burying our heads in the sand about this system. American exceptionalism. We're exceptional, all right, just not in the way that we've been sold.